Good morning. Can you all hear me? I think you're muted, so if someone could type a message in and maybe I can unmute you. Let's see what happens here. Can you all hear me? There we go. Let's see. Okay. So I'm hoping that you all can hear me. Can anybody confirm that?
I can hear you, Alda.
Oh, very good. Thanks so much. It's just always one of those things you just want to know. Okay. And let me see. Okay, so I think we're ready to start. And I just want to check one last thing. No, that didn't do a thing. Here's the dashboard. Okay. Alrighty. Well, I am trying to figure out if we're recording, but I cannot find the place. But in any event, we're ready to start. So welcome, everyone. My name is Alda Schuyler. I am the Director of Crossroads Recovery Coaching and Training. I'm a credentialed life coach with expertise in addiction. And this talk today is about medical marijuana. I am lucky to live in Port Angeles, Washington, in a state that has legal medical marijuana and legal recreational marijuana. So, you know, that makes things a bit easier. But let's go ahead and get started. So the topic is about guidelines for new patients. One of the things that I noticed in Washington was that there were a number of people who had been given prescriptions for medical marijuana that had never used anything like it in their life, and they didn't have a lot of support in determining what was going to be helpful for them. And it's a little worse now because they closed the medical marijuana stores and only have recreational stores now. So, but in any event, the goals of this talk are to help people understand why marijuana is prescribed, some basic information about marijuana so that you can get a sense of what might be helpful to you and how you might want to take that. And then I think the most important part are the protective habits to get you off to a good start. So medical marijuana is, you know, it's been around for thousands of years. There's records in Sanskrit of its medicinal use. And so it's been known for having various medicinal qualities, and those include inhibiting cell growth. It reduces inflammation, which reduces pain, and it also alters the perception of pain, and so it's typically not as perceived as being as strong as it was before. It's also well known, especially now, for reducing seizures and convulsions. They use it with children with epilepsy, and we'll talk a little bit more about that. It helps decrease muscle spasms, tics, and increases appetite, reduces nausea. It helps with a number of things, including cancer and AIDS. With both of those, there's pain, there's a loss of appetite, there's wasting of, you know, starting to lose your own muscle mass, that kind of thing. And so it helps with both of those. And I think I mentioned the epilepsy and gastrointestinal problems. It has an effect on that. It increases appetite. It's been long known to be helpful with glaucoma, and it's used more and more to reduce symptoms of PTSD. So it's also used because it does have side effects, but it has fewer side effects than many drugs. It is never fatal. There's never been a fatal overdose from marijuana, and that's a good thing. It can be used, using medical marijuana can reduce or replace the use of more dangerous drugs, including opiates and benzodiazepines, Valium, Xanax, that kind of drug. And because it's not opiates are central nervous system depressants, which slow the heart rate and make breathing more shallow. Opiates and benzodiazepines are really not very good for older adults. And so one of the uses of medical marijuana is if you have somebody who you're concerned can't take an opiate, they'll be prescribed the medical marijuana. There are some challenges with it. We've long known that there's short-term memory loss. There may be some long-term, but as I understand it, the memory loss patterns tend to stop when you stop using it. But it does cause those problems. It can lead to a lack of motivation. Recently, they found that it damages the gums, which can be a serious thing because that's how you get infections in your heart. But anyway, and it can also lead to addiction or overuse. So there are challenges, and they're learning more. But as we'll see, there's some problems about that. There's challenges if you're prescribed medical marijuana. Your prescription just typically says use as needed for relief of symptoms related to cancer, pain, whatever they're prescribing it for. But unlike other medical prescriptions, your medical marijuana prescription will not tell you what type of marijuana to use, how to use it, how often to take it, or how much to take. So that makes it hard to sort out what is a medicinal dose and to be able to take a standard amount. And that, I mean, I think that's really quite a challenge with this thing. And that's in spite of the fact that 24 states have legalized medical marijuana. There's 4 states, one of those is actually Washington, D.C., that have legalized marijuana for recreational use, but it is still illegal at a federal level, and marijuana is still illegal and prohibited in most states, and so that makes it risky. So one of the effects of prohibition of marijuana is that there's very little quality control. As I just mentioned, there's little to no guidance by your healthcare provider, and there's legal consequences of possessing or selling marijuana. Okay, and the lack of research is the reason that there's a dearth of research is because in the 1970s, marijuana was declared to be a Schedule I drug, which characterized it as being highly dangerous and having no medicinal use. And so that was just renewed a few weeks ago. I think it's really amazing that with that many states using medical marijuana that we still make research on marijuana illegal. So, as a result of that, there are many things that marijuana does and does well, but we don't have the research on how to use it and how specifically to use it with various diseases. And so that's just going to be that way. Other countries are way ahead of us, and maybe someday we will, I'm not sure what we need to do, but the law will change. Okay. So here's some marijuana basics. So I'm going to start with cannabinoids because everything about how marijuana is talked about in terms of THC, the psychoactive cannabinoid, and CBD, which is a calming one. But cannabinoids are the compounds that are made by the plant, and what is interesting is that there are receptors in really throughout the body, in the brain and also throughout the body for cannabinoids, which suggests that our body makes cannabinoid-like substances. But again, there's something like 60 to 80 other cannabinoids that we know very little about, and of course the research to find out about that it's not going to happen in this country. So those two cannabinoids, THC and CBD, they naturally occur together in the marijuana plant. The THC is the psychoactive part, the part that gets you high. The CBD part is calming and is reputed to have antidepressant effects. CBD is the cannabinoid that is useful for epilepsy. So Charlotte's Web is a strain that is almost entirely pure CBD. There's not enough THC in it for it to be psychoactive, or at least that's what I've been told. And so it was, when they made it, when the growers grew it, they were like, what is this good for? Well, it turns out that it stops epilepsy, seizures in children, and I think adults as well. And so, but it's also nice because people often don't want to give their children the THC part, but in this case they can get the benefit without the psychoactive aspect. But most people will tell you that medical marijuana works best when both THC and CBD cannabinoids are present. So there's two basic strains of pot plants. There's sativa and indica. These are apparently Sanskrit words. Sativa, I've heard, is the Sanskrit word for day or morning, and indica is the Sanskrit word for night. And so sativa is more psychoactive, and people will want to use that during the daytime, and then when they want to calm down, then they might switch to a sativa with a higher CBD and use it at night. There are many, many, many hybrids out there. Most of them have been developed for the recreational market, and they're going to have a very, very high THC level. But sorry if I can get this to, I can't remember how I fixed this before. Let's see. Here we go. Sorry about that. So medical marijuana, I think well, anyway, to the extent that it's graded at all, it's going to be graded in terms of levels of THC. And so what you're going to find is that most of the recreational marijuana, which in some places is all there, I think the medical side of the marijuana legalization has, because it's a smaller market, it doesn't get the attention it deserves. But in any event, so commercially grown marijuana is very likely to be high THC and low CBD. Sometimes it's got so much THC and so little CBD that it produces paranoia and that kind of thing. Most medical marijuana is going to be higher in CBD than recreational marijuana. In some cases, it'll be, say, a 4-to-1 ratio of CBD to THC, or something like that. But again, it's something that you want to be able to go into from somebody who can tell you what the relative content of THC and CBD is in a given product or plant. So there's a variety of ways to take medical marijuana. These would be called routes of ingestion. So I would say the most common one is inhaling smoke from a joint or a pipe. That's not the safest, but it is very common. A lot of people use vaporizers, and vaporizers avoid the tars, and so they're easier on your lungs. We're going to talk more about edibles, but that is marijuana-infused cookies, candies, etc. And it's very important to keep those away from children because they will not know that it's medicine. Medical marijuana is also available often as a tincture, and that would have been made either using alcohol or glycerin as the solvent. Both of those are safe, but some people don't want to use alcohol, and so they would prefer a product that was dissolved using glycerin. There are salves that can be applied to the skin, and those typically have a low psychoactive effect. But because there's also patches, clearly you can get THC into your body and CBD into your body through the skin, and so I can't swear that all salves are low psychoactive, but certainly the ones that I've seen are. And then there's also inhalers, and those are by prescription as well. So these last ones are typically products, the ones with the asterisk are ones that you will find in a medical marijuana store. Typically those things aren't, they may have what they would call a vape pen or something like that in a recreational marijuana store. They may have some edibles, but again, they may have products that are very high in THC and low in CBD, so you may or may not want those. Okay. So this is what a vaporizer looks like. There's many different sizes and shapes. Some are pens, some have sort of balloons on them. What they are doing is they are increasing the temperature of the bud or the oil that's been put inside this device. It's heating it up, but it's not burning it, and so there's no tars. You're getting kind of the vapors rather than the smoke, and so there's not smoke associated with a vaporizer. So I noticed, I think some vape pens sort of find some ways to make it look as though there's smoke coming out. But anyway, okay, these are sort of the edibles, you know, lovely looking pieces of candy. But again, the problem with edibles is largely that when you take something by mouth, it takes longer to get into your system than if you smoke it or use a tincture. And the problems will be that people will decide that gee, this stuff isn't very strong, I'm not feeling it. And then they'll take another one and, you know, wait another 20 minutes or something and go, gosh, I'm still not feeling it, and take a third. And then when all of them kick in, that's how we've been having marijuana overdoses show up at emergency rooms in high numbers in states that have legalized marijuana. And it's almost always through edibles, that type of, they call it stacking. And it's the most common way to overdose, and I understand it's highly unpleasant. So tinctures, the advantage of tinctures is that, in a sense, whatever is in there, you can test out a drop, see what effect it has. Does this reduce my symptoms? And so in some ways, you have the most control over the amount that you take with a tincture. And that would be the advantage of that method of ingestion. There's problems associated with some of them. Inhaling smoke, if you're smoking joints or pipes, it's hard on your lungs. There seems to be little risk of cancer from smoking marijuana, unlike tobacco, but it can cause the same sort of shortness of breath, coughing, et cetera, et cetera. I just talked about edibles as a common source of overdosing. And so the thing is to start, take a small amount and wait a long time to see what it does before you take any more. It's hard to know how strong any medical marijuana is. Sometimes they'll say there's 20 milligrams of THC in this or something like that. But I don't know that it's how regulated or well tested it is, and there can be variation from product to product. Okay, so we're in the protective habits. We're starting into this section. So here's the medical marijuana mantra. Start low, go slow. So that means if you're smoking it, take 1/2 little puff. Don't take a big one, take a little one, and wait. See what happens. This mantra will save many people from finding themselves, in a psychoactive state that they didn't intend. So if you start with low doses and you go slowly, you can really determine how much of this you're taking and what level of effect you respond to, and that's what the goal of medical marijuana is. So there's some protective habits that will help you. One is to buy whatever product you decide to use. So I would say you're going to have to first have experimented a little bit and find out what works for your symptoms. But so once you've established that, you want to buy enough of that to last 1 to 3 months, really preferably 3 months, so that you can standardize your dose and take it in a regular kind of way. So I think avoiding smoking is a good idea. So if it's possible, use one of the other methods. I think people can become over-reliant on any drug, and there are always a variety of ways to reduce symptoms. My husband Paul, the other day, his shoulders were hurting him. Ibuprofen wasn't doing a thing. He's not a medical marijuana user, but he went and took a hot tub and got a massage, and he felt better. So when you think about the symptoms, see if there are other ways that will support, feeling better, and see if you can find ways other than just using drugs. Okay, so avoid using medical marijuana for emotional reasons. I think this was a major aha for me, but when you use a drug to simply make you feel better, you're missing the message of the emotion. We experience negative emotions when we have a need that's not being met. It's important to take some time and go, why am I angry? Why am I afraid? Why am I lonely? Whatever it is, and understand what the problem is and see if you can resolve the problem. Because just getting rid of the feelings means the problem gets to stay stagnant. And so anyway, so I think it's important to avoid using it for, gee, I don't have anything to do, I'll get stoned. I recommend that people avoid social or recreational use because it's confusing. If you're using marijuana socially with your friends, they might want to try your medical marijuana. It just sort of blurs some boundaries that I think are good to keep. And that I think of a protective habit that I'm going to talk more about is tracking your use. So I suspect that'll come up soon. So a protective habit is to think about using marijuana in a way similar to other drugs. So again, with other drugs, you're told what the dose is. You need to establish your own dose. What works? What type works? And once you establish your dose, then you want to take the same amount each time, and you want to take it at the same time each day. And that, that's going to be based on what symptoms you're trying to deal with. A lot of people use medical marijuana because they have trouble sleeping. They don't use it at all until right before they go to bed. That would be, using it at the same time. I think it's important to think about, where am I getting my medical marijuana? If you're getting it from a medical marijuana store, you want them to know that you're a regular customer and to keep whatever strain or product it is that works best for you in stock. But it's also good to know, what am I getting? Is this high THC, low CBD? And who made this stuff? How strong is it? Did the people who grew these plants, were they organic farmers, or so it's good to get some sense about what the product is and who made it, where are they getting it. Is the store testing for pesticides, et cetera, et cetera? Do they have standards? Do they? So tracking is your friend, and tracking, I think, is really, it's a habit that in a sense is your responsibility to yourself. And so I suggest that tracking start by making a list of symptoms. What symptoms do you have? What were you prescribed this for? And it may be that you find it useful for symptoms that you weren't prescribed for, but just get clear about what your symptoms are and then establish a measure for that. How bad is my pain? How severe are the muscle spasms? How awful is the nausea? And to find a scale, you can use 1 to 5, 1 to 10, whatever scale you want, stick with it, and notice how strong the symptom is, and then also write down what did you do to relieve that symptom. So you're going to want to say, I took 2 puffs of my high CBD, and the level of pain went from a 7 to a 4, something like that. So you're going to come up with a system for noticing. The time of first uses can be a good thing to notice, because if you can avoid using it until later in the day, that's better. That way you're not spending all of your time in an intoxicated state. And again, because there's such a variety of strains, the marijuana types, if you go in a marijuana store, they all have weird names on them, headbanger, or, train wreck, or something lots and lots of different names. But you'll want to make a note of the name, find out what type it is, and make some notes about whether this works, what does it work for, how does this particular thing, and you may find, hey, I don't like this one at all, I'm not getting this again. But if you don't write it down, you won't remember. So I was someone that, I had used medical marijuana, and now I had used marijuana when I was young. I stopped that, 30 years went by and never used any of it. And I was not really that happy about ever using it again, except that I had symptoms that if I were to try to treat them with opiates, I would have become addicted to opiates. I did try benzodiazepines, and they didn't work for me. It gave me awful headaches, and yeah. So they worked for a while, and then they quit, which I think they're famous for. So I took a long, long time to make a decision about whether to use medical marijuana. I talked it over with medical doctors and other important people, and it was a very considered decision. Still, I found that there were positives and negatives about it, and I think it's a good thing to just notice. So I slept way better. I had lost a lot of weight. People at one point were asking me if I was anorexic. I'm like, no, I eat, but I kept losing weight. It helped with that. I didn't expect that it helped with PTSD symptoms, but it did. It does. It wasn't prescribed for that, but hey, I noticed that. For me, it relieves spasms that were stopping me from sleeping, improved my digestion, and overall my health was improved and I functioned better. But I felt badly about using it. I didn't really want to be one of those people, but oh well. I think the kind of memory problems, or ADHD already has some problems with memory, and it can aggravate that. I know my lungs don't like it, and there were times when that was the only option I had. That's no longer true, but there was a time when that was true. I think that the symptoms that I like the least are sort of the lack of motivation and lack of creativity. The very first time I used it, I said to Paul, I feel like I put a lampshade over my mind, over my brain. It just sort of, just brought me right into the here and now and nowhere else. There's some social stigma. It's funny because there's social stigma, and then there are other people who are like, oh, cool, you smoke marijuana, great. Here, try mine. So whether that's good or bad, but there are people who will think badly of you for using marijuana. I suggest that if you don't discuss your other drug things with your other medications with your friends, don't discuss this one. I believe that unlike other drugs that are standardized, medical marijuana is a genuine effort to manage it. And I think it's important to know that because it's very easy to get into bad habits or to use more than you want or to use more than is medically indicated. So I have a couple of cautions. So marijuana can really rapidly lower your blood sugar, and that's what causes the munchies, but it can drop so fast that you'll get dizzy. That happened to me once or twice. I didn't buy that strain again, but it is something that can happen. So you wouldn't want that to happen in a dangerous situation. So if you're trying something for the first time, do it at home in the comfort of your lounge chair or whatever. Plan when to use it. Avoid driving when taking medical marijuana. I'm sure there are people who drive all the time. I'm not sure it is as dangerous as a high alcohol intoxication, but it is still dangerous. And they are finding that there are medical marijuana car wrecks. So I highly recommend that you not drive. It's illegal for one thing, so don't drive when you're taking medical marijuana. Marijuana can negatively affect how antidepressants work. I cannot explain what the biochemistry of that, but I have been told by practitioners that if their patient is taking marijuana, that a lot of times the antidepressants simply don't work. I don't know why, but it's just something to know. I would say if you're a former tobacco smoker, that smoking marijuana can activate all those old impressions of smoking. And as a former smoker, I know that I suddenly went, wow, I think I'm using this more than I need to because I like to smoke. And so I stopped smoking just because it was something that just, I don't want to use it for reasons other than the medical symptoms. Okay, so here's a kind of a little bit of a recap. So we know marijuana has been used for centuries, really thousands of years. So as a medicinal herb, and that it has medicinal properties. We know it's not standardized, and you were given some information about choosing the type of medical marijuana that works best for your symptoms. I would say that if your symptoms are neurological or nerve-based or anything like that, you definitely want a high CBD strain, and how much THC you can sort that out for yourself. But I would say for pain and that kind of thing, really you probably want some combination of THC and CBD. Just intend to pick the safest available route of ingestion. If you're lucky enough to live in a state where there's medical marijuana products and you can afford them, then use the tinctures or the edibles or the salves or the patches, and avoid smoking. I'm highly encouraging that you establish a dosage and that you take it as you would other drugs. And I also have suggested that you find other ways to manage the symptoms, so you're not just relying on medical marijuana to take away all your pain and that kind of thing. As I mentioned earlier, avoid smoking. I think it's important to notice if you're using more than you need to relieve symptoms. That's one of the reasons I suggest that you track, because you'll be able to go, oh, wow, I used to only take 2 puffs and now I'm taking 4. I wonder why. And you can then make a decision. I've also suggested that you avoid using marijuana for emotional or social recreational reasons, and that you track your use. And we will end with our mantra: start low and go slow. Okay, so I'm going to open it up for questions and comments. If any of you want to reach me, you can reach me via email. My email address is coachalida@gmail.com. And let me get this little thing over here if I can encourage it to. Well, in any event, there we go. So I am going to unmute everyone. And see if there are any questions or comments. So again, you have 2 ways to ask questions. I think you all are unmuted, but if you want to type it in, you can do that. So are there any questions or comments? Can you hear me? I've not seen anybody. I guess I'm going to just wait another minute and see if there are any questions or comments. And if not, then we will end the program. So you all are unmuted. Yeah, go ahead.
Hi, Alida. This is Lori Fear. Thank you. This was a very informative, very helpful presentation. And I'm just wondering if we could get a copy of the presentation slides, whether that's something that you could make available to us, because there was some good information that I would like to share. I'm a coach too, and I would love to be able to share this with some friends. One friend in particular who has a son who's taking medical marijuana in Maine, and she had some questions for me, and this would help me to be able to help her.
Right. Yeah. I will attempt to do that. The best thing to do is to email me and remind me that you want me to send you that. It's my intention, and as I say, I was trying to figure out whether I had turned on the recording, but somehow it took that option away. So I don't even know if it was recorded, which is a little weird. But anyway, but my intention was to make this available and put it on YouTube.
Yeah, so, that would be great too.
And if I didn't record, I will just re-record it. Go ahead.
I will email you then and ask for the presentation slides. And again, thank you. This was really helpful.
Okay. Yeah. Any other questions or comments? And as they say, you can type them in if you prefer. Okay, well, I think we're done. If anybody did want to hear about the Crossroads Recovery Coaching Training, I'd be happy to stay and do that. But that wasn't our topic, so I'm assuming that everybody's fine. Okay. Alrighty, well, thank you all. I appreciate you coming and hope that this was useful, and wish you the best of health and happiness. Okay. Thanks, everyone. Bye-bye.